Hello, this is Dr. Adam Stewart from stewartmedicine.com. I'm making this video to demonstrate and explain a new approach that I have been using in my practice to schedule and triage visits. It's a process where we direct patients to start by submitting any and all concerns via an online submission section on our website. I'm making this video with the intended audience of both patients and physician colleagues. Patients might wonder why we are using this new process, and this will help show the reasons, including what is going on in the background at our clinic. Family doctors are strained and burnt out. It's a struggle to keep up with the needs of all our patients, and it can seem like there's not enough time in our days. This process of scheduling and triaging increases capacity. It helps save those valuable in-person visits for those who truly need to be seen in person, while also tending to patients who do not need to be seen in person by other modalities that may be more efficient. By raising awareness of these possibilities, this can help optimize the capacity and the efficiency of the entire province's healthcare system. The online submission process that we're talking about here is a link off of our website where the patient clicks Online Services, and this section here where they can submit any concern or request. So you click there and it opens up the box where the patient just has to identify who they are. This is just a fake submission, so just going to put in some fake details. Chooses who the doctor or nurse practitioner is, and then the reason for contact, and this ranges for anything from new issues to follow-up to prescription renewals to forms, any reason that the patient might need to contact the clinic. In this case, we'll say, let's pretend it's a new issue for some numbness and tingling. So click here, and that prompts a questionnaire for more details on numbness and tingling. I'm just going to breeze through this one just so you get the look and feel for the questionnaire and how this looks. And later in the video, we'll do a more thorough dive into the details and what it looks like on the front end and the back end. So when the patient clicks next, they're finished the questionnaire. Here's an area where the patient can submit any other free text areas for additional details. And when we're done here, this submits the entire note and questionnaire into the Ocean portal, which then gets downloaded into the patient's chart with all of this information. At the end here, we're just going to show it quickly. It redirects the patient to the option for online booking, but that is beyond the scope of this video here. In healthcare and family medicine in particular, the demand far exceeds the supply of accessibility. There are many different ways to access healthcare these days, including phone, email, messages, and other ways. But in-person visits are the scarcest, and they must be used as efficiently as possible. In-person visits must not go to waste. Not only are they the most limited in supply, but this is when the clinic is open and the staff are present, and they're able to prep patients with vitals and everything else that's needed to ensure that in-person visit goes efficiently. So the question for every patient concern should be, does this truly require an in-person visit? Or are there other methods that can appropriately address the patient's concern more efficiently, like phone or email, or even sending in a photo of a skin spot or rash? More importantly, perhaps this was a question or concern that the patient could self-manage with information provided on my website. That's one of the things that this online submission workflow enables. Patients have hundreds of concerns every day. When the doctor's schedule gets filled with knee-jerk automatic bookings for every single question or concern, the schedule for that day and the week or the month fills up very quickly. And then there's no spaces left for patients who truly need to be seen in person. There are different variables that come into play when scheduling a visit. I like to look at it in terms of urgency or modality, which is like the type of visit, like meaning in person or phone or email, and the visit length. And then other things like the preparation required, like does the patient need to submit more questionnaires that would be helpful to have up front? Or is this needed in a procedure room versus an exam room? Do I need liquid nitrogen in the room for a wart or things like that? Having all of this information and details about the concern up front helps us to decide how to plan and optimally address the patient's concern. The online submission process does this. The patient is able to provide as much detail as possible before the visit is booked. Let's take a quick dive into visit urgency. There are different urgencies for visits. Some are very urgent and need to be seen that same day, or maybe directed to the after hours clinic that night. Some are semi-urgent, meaning that maybe they need to be seen the next day or this week, but can't wait several weeks. And then other things are totally elective, like diabetic visits, for example, or they can be pre-booked at a later date down the road. A little disclaimer here is that for emergent concerns, a family doctor's office was never intended for emergent concerns. Those, by definition, need to go to the emergency room. A certain amount of onus and responsibility is on the patient to recognize the need to call 911 or go to the ER. Like if someone has severe 10 out of 10 scale chest pain, or they're so short of breath they can't walk across the living room, or they have stroke symptoms, they need to be calling 911 and emerge. It's not appropriate to be contacting the family doctor's office, whether it be via telephone or email or on this online submission process. Now let's talk about the visit modality, which basically means the type of visit. There are many different ways that patient concerns can be addressed. For example, the most important might be the self-education and self-management. If a patient can read information on my website and that answers all their questions, they might not even need to contact us in the first place. Then there's the traditional in-person visit. There are also video visits these days. I personally don't like those as much right now because the technology hasn't caught up efficiently on both ends, both the patient and the doctor. Nowadays, telephone visits are much more common. There's direct email and messaging between the patient and doctor. There's technology and portals that allow for this to happen. And then there's a common indirect relay of information via staff. That can either be via phone calls or messages back and forth or emails. So all of these different modalities have their advantages. Again, knowing the details up front related to the concern, as much detail as possible via the online submission process, helps us schedule the type of visit most appropriately as well. I just want to take a deeper dive into the visit type here, just to have a look at the amount of doctor time and staff time required for each of these options. At the very top, you'll see again the self-management, self-education section requires no doctor time and no staff time. So when we're trying to balance the high demand for healthcare and the limited accessibility, this is optimal whenever possible. There's in-person visits, traditionally 15, 20 minutes, but there's also all the staff time that's required to book that appointment and to have check in the patient and usher the patient to the room, check the vitals and so forth. There are video visits, which, as I pointed out, I think can be a little bit more time consuming when you take into the consideration the technological startup and ending and connecting with the patient. Again, this takes staff time to book. The phone visits can be a little bit faster. Sometimes visits, I think we've seen, can be a quick 2-minute telephone call for quick items. And if the doctor is the one just calling in or initiating this directly with the patient, there's 0 minutes required of staff time there. Portals and email messaging can vary, but it's a very efficient way these days to manage accessibility. 1 to 5 minutes of doctor time writing a message or an email. And again, 0 to 2 minutes, depending on if and the technology platform being used. And then what I use a lot in my office too is indirect relay of information via staff. So the staff can send me a message. I can be between a patient. I can answer that question quickly on the EMR messaging system, and then the staff can relay that information back to the patient or advice. And meanwhile, I've only had to take maybe a minute or a couple minutes to write that message, whereas I haven't had to take any time to actually connect and be the one actually relaying the information. Therefore, I can be off seeing the next patient. Again, if the doctor and staff time are used the most efficiently, that can increase the capacity of our healthcare system for everyone. Take a deeper look into an example of an online submission. Let's take the example of a patient who has back pain, lower back pain. So the patient is directed to the website, and again, this is just going to be a fake patient chart. This is not a real name. I just happen to have a fake chart with this name in there. So in my EMR. So let's say the patient says then, what is this? This is a new issue. And there's pain. And it's back pain. Now, you'll notice this expands here and it says, you often do not need to see the doctor or nurse practitioner for musculoskeletal back pain. Please visit the following link to learn more. So it directs the patient to click on that link, which opens my website to my back pain page, which has a bunch of helpful information on the common mechanical low back pain that might be of tremendous use for the patient, and it explains a bunch of information, videos, pictures, explains things like why imaging isn't required often, what the patient can do, and of course red flags to watch out for, and some additional resources, and very thorough. So this is a very thorough page on what to do for back pain. Now, so let's say the patient that answers all the questions. They said, okay, well, maybe I just need to go see my physiotherapist. So if this answers all of your questions and you no longer feel the need to contact us at this time, please simply close and exit this questionnaire. But let's say the patient's read this and the pain is maybe a little different than what's being described here. Maybe it's in the groin or in the hip arthritis. So I have reviewed the suggested website, but I still need to contact the clinic. Yes, the patient clicks here. The pain is in my groin. Worried about hip arthritis. So this is just a quick example. Now, this then prompts for more information on the standard low back pain questionnaire. So again, I'm just going to go through this quickly for the sake of demonstration, but the patient would answer all these questions, and I'm just going to click a few randomly here, just again for the sake of it. What have you tried so far? Rest helped, heat didn't help, Tylenol didn't help, anti-inflammatories helped, and so forth. Physio, that's have not tried, and things like that. Are you able to afford physio? And a bunch of different questions that gives us at the clinic more information up front. The free text area for more information, and then again the little prompt for online booking. So in the background, what's happened is that all that questionnaire and information gets submitted into our portal, our Ocean portal, and then the staff review this, and then they are ready to import it securely to the chart. So here, using Ocean technology, you get a code for that in the portal for that end, and we import that information. It just asks us to confirm that the person is correct. Again, this is a fake patient. No real information is being identified here. And you'll see what's done here is like this just directly imported into the chart here. All the information that we just did, the output can be color-coded and programmed as you like in Ocean, the diagram where the pain is, and it gives us a bunch more information. Now, if this were the real world, I might say, and I see that up here, this was the patient's, what was the specific concern beyond what was offered on the website. And so in this case, I might think, okay, I need to book this person in for an in-person visit. So you contact your staff to do that, or just message your staff. The way I have it set up in my charts is that I have a little toolbar here with a button. Online stands for online submission. It pre-populates to our Madoc front inbox for the messages, and I say in-person visit. A couple clicks, and you see that that's there. And then my staff will contact the patient and book the visit. Now let's look at a different example. Let's say the patient has a skin spot that they're concerned about. So again, patient is directed to the website. Fake patient here. And so the new issue. And skin rash concern, and what type of, more specifically, it's a skin spot or a mole. Now, again, this is one of those areas that I have a website that may be appropriate here, so please visit the following link for more information on skin spots. And then here I have my skin spot webpage that shows some common examples of things that are concerning things to watch for, and then things that are more common but maybe not concerning. And it gives patients some photos and information to help self-manage. Now, often though, the patient, appropriately wants to have this checked out. So I reviewed this website, but I still have questions and concerns. Maybe they have a spot that's a little concerning. So they click that, and then down here you see, please submit a photo. Now, technology at this point isn't great for allowing just an attachment. Actually, it's not possible to just attach a photo here and link this to the submission. I hope that'll come someday. But for now, we are just asking patients to email the photo to us, and then we get all this information in our Ocean portal, and then the photo comes in, and then the staff put both into the chart. So yes, I will be submitting a photo. And then here's just some more information that the patient can submit. Bleeding, crusting, no. So it's all these questions. And again, that final thing on offer any more additional details that might be relevant. So the patient clicks finish. We get that information in our clinic, and then I can decide on the most appropriate way to handle this. For example, let's say it was a large-looking skin cancer that I couldn't handle in my clinic, and I would then just refer directly to a surgeon. Or let's say it's just a small solar keratosis or a plantar wart that I know I can book a liquid nitrogen visit in my clinic, and I can just zap it with liquid nitrogen. That just requires a 5-minute visit. Or let's say it's a larger skin spot that I want to maybe take a biopsy of. That requires us to book a visit in our procedure room with a nurse with all the material set up to do the procedure. So you can see, getting all this information up front helps us book the visit most appropriately. If a patient was booked with a knee-jerk reaction, 20-minute visit to come in to have me look at a mole, but then my nurse and my procedure room aren't all ready, that's going to cause 2 visits, which is not good for our accessibility, nor is it convenient for the patient to have to come back twice. So by getting all the information up front to this online submission process, we can appropriately manage the patient's concern in the most effective and efficient way possible. I'll show another example here of a patient who might need both a prescription renewal and a physiotherapy insurance letter. So again, patient is directed to the website. Start here. Fake patient name again. This isn't a real patient. And they just identify who they are. Next. So here you can click actually more than one option. You can say prescription renewal, and I need a physio insurance letter. So it prompts us to go through here. What type of letter do I need? Physio insurance coverage letter. What's it for? Low back pain. And then it directs the patient to, this is an uninsured service for these types of insurance letters, not covered by OIB. So it links them to my web page on uninsured services for more information. And then having said that, the patient can consent to the fee. And then now we're to the prescription part. What pharmacy? So we have a list of our local pharmacies. And they're going to choose what doctor there, how many medications they need renewed this time. So let's say it's just 2, for example. And they need metformin and rosuvastatin. And let's just, it also gives you a free text area. Can this please be done today while I'm in town? Something like that. And then the patient can click next, finish off, and again, all this information comes into our portal, which then goes into the patient chart, and I, as the doctor, can address that without the need for a visit here, an in-person visit. So hopefully this has helped explain this modern approach and why we ask patients to submit concerns online. Healthcare is in a supply versus demand crisis, so we need to optimize everyone's time. That's physician time, staff time, and of course the patient's time. This helps us do so by triaging and scheduling visits in the most optimal way possible by empowering patient self-management and also getting as much information up front. And as a little added bonus, it also helps free up busy doctors' phone lines.